Myself, Dr. Boris, a naturopathy and yoga physician working for 10 years at National Institute of Naturopathy Pune under the wing of Medicine. We deal with musculoskeletal disorder, neurological disorder, metabolic disorder, also geriatric rejuvenation, weight loss management with the principle of naturopathy and yoga. To receive further updates regarding the webinar and activities conducted at NIN, please like and follow our Facebook page. Patanjali Yoga Sutra is one of the authentic and traditional textbooks on yoga, which is a guidebook for the practice. Let us listen to the Yoga Sutra chanting before getting into the session.
Thajjapasthadarthabhavanam. The translation is, through repetition, its meaning becomes clear. Patanjali says, through generating constant repetition of the pranava, the Om, the meaning behind the sound is realized and becomes manifested. When we chant the Akara, the vibration rise up from the depth through the abdomen and chest and back of throat. When we chant Ukara, the vibration rise through the throat to the top of the palate and to the crown. And the Makara finishes the shape of the sound as a natural expression of Ishvara at the crown. It is said that Om is the only mantra that Patanjali recommends in the entire yoga. Let us now move on to the further benefits of Omkara through Patanjali's sutras. Tata pratyakchedanadigamopyandaraya bhavascha. The translation of the sutra is, then interiorization develops and obstacles fall away. Here, Patanjali clearly explains the benefit of chanting the Pranava mantra or the Om. He says, through the practice of the Pranava, as a dedication towards realizing Ishvara, consciousness is redirected inward towards the realization of the intrinsic light of consciousness, and also obstacles and hindrances are thus removed. Here, the obstacles, hindrances, blockages, psychic lessons are uncovered, dissolved, eradicated, or transformed through the chanting of the sacred mantra Om. By keeping in mind all the benefits of Om chanting, let us begin and end the yoga session with Omkara chanting. Thank you.
Let us now continue to the main session. Dr. Sujan Herbert studied BNOS in the year 1992 to 1998 from Rajiv Gandhi University, Health Science, Bangalore. He also did MBA in Hospital Management in the year 2002 and PhD in Clinical Psychology. Dr. Sujan Herbert started his career as a medical officer in Sanjeevani Holistic Health Farm from 1998 to 2001. He also worked as a lecturer at JSS Institute of Naturopathy and Yoga, Ooty from 2001 to 2002. From 2007 to 2009, he was appointed as a principal of Sri Ramakrishna Medical College of Naturopathy and Yoga, Kulasegaram, Tamil Nadu. Presently, he is a medical officer at Government Headquarters Hospital, Padmapuram, Takkalai, Kanyakumari, Tamil Nadu. Also, Doctor has his own clinic, Paradise Yoga and Naturopathy Hospital, Kanyakumari, Tamil Nadu. Now, I would like to invite Dr. Sujan Herbert to the webinar on topic yoga and physiology. Sir.
And thanks to all who has arranged this program, especially the director of NIN and other staffs of NIN. This is a good opportunity for me to, you know, give the ideas ideas of mine to the public. And as Yoga Day is approaching, the NN has got taken an good step towards introducing yoga to the public. Uh, Anyhow, the anatomy and physiology, that is the normal structure and normal function of the body, is very, very essential. And maintaining the normal structure and normal function is very essential to maintain a good health. And based on that, we will discuss about the anatomy of the body, and then relate with the uh, yogas, like asanas, pranayamas, meditation, and whatever it is. So to start with, we will slowly move to uh, some asanas and the spinal anatomy. We do so many asanas every day. We see so many asanas in TVs, texts, etc. There are simple asanas. Some people go for complicated asanas starting from childhood. Some people are always interested in doing advanced series of asanas, and of course there are thousands of people join together and do asanas, and there are clinical, therapeutical yoga, etc., and etc. But the structure or maintaining the anatomy of body is very, very essential. In that, first and foremost important thing, as far as my knowledge is concerned, is the spine anatomy. Starting from neck to hip, there are 33 vertebrae, and we have got primary curvature and secondary curvature. So the curvatures are very, very important to maintain the body health. The weight bearing line is very important. The center of gravity, the line of gravity, decides the health of spine. So even a position of belly, or a position of hip, or obesity can change the spinal curvature. Any injury or any painful issues can change the curvature of spine. So when there is a damage in a spine or a disc, this is a very, very common issue. When there is more compression to the disc, in which is placed in between two vertebrae, there will be a pressure to the spinal nerves by the inner pulposa, which pushes out, and so that the curvature of the spine is changed. That means the lordosis, normal curvature, anterior uh, pushing, anterior convexity of the spine is changed to erect position. So in this you can see when the spine is fully erect, then it is a uh, painful issue. Actually, this is due to muscle spasm around the spine due to any painful situation nearby, or any damage or any injury nearby. So in this scan, you can see the erect spine, whereas you don't find any curvature here. Actually, if there is a mild curvature, uh, the spinal, what is it? The weight bearing joint differ. The center of gravity differ actually. So when you move on, to maintain the spinal curvature, it is very, very important. Uh, you know, Doing some asanas. We do simple asanas, to maintain the spinal curvatures. See in the next slide, in the video, you can see that. So a simple Bhujangasana I have shown here. When we do the asana, the anterior aspect of the spine expands and posteriorly it is compressed so that the negative pressure is created anteriorly. Medical people can understand very easily. When there is negative pressure anteriorly, the protruded disc is sucked inside. It is very simple phenomenon. Actually, it is a mechanical thing. It's a physics only. So when the protruded inner pulposa is sucked inside and placed in the position, that is in the anatomical position, then the compression is relieved and it is very easy to maintain the curvature too. So in the Bhujangasana, the curvature can be maintained. That is the normal lordosis. There are so many other asanas even to maintain the curvature. If you see the next slides, you will find that you know in the Bhujangasana, uh, you can see the curvature how it is in the lumbar area, the lower back area, and of course there are so many muscles in action, supportive muscles. You can see the erector spinae muscles, the even gluteus maximus, the inner muscles like quadratus lumborum, the psoas major, etc. So there are so many anatomical structures helping us to maintain this normal curvature of spine. To improve that, we can do again some other asanas like Shalabhasana. In the next slide, we can see that Shalabhasana and even Dhanurasana. These are the asanas can correct the spinal curvature. Of course, this Dhanurasana and uh, complete Shalabhasana may be bit risky. That can be practiced by the help of some qualified medical personalities, and to strengthen the back muscles, the Sedbandhasana and such asanas can help. In this one, the back muscles are strengthened very perfectly and give nice, you know, uh, it takes you to normal anatomy. And in this one, if you see the agonist muscles like gluteal muscle lift you up, and along with that there are so many supportive muscles which can be seen there. The thigh muscles, quadriceps supports that, the erector spinae muscles support, and again inner muscles like quadratus lumborum, and so on. So there are so many group of muscles they support and form the proper curvature. So maintain anatomical position of a small place is with so many muscle action and bone movements. You can see the muscles around these muscles, all the muscles, they must be with good elasticity and good strength to maintain the proper curvature of the spine. It is very essential to maintain the curvature. The anterior and posterior muscles, you can see in the video, the anterior and posterior muscles. Next slide. So see this video. Both the side we have got muscles, and both muscles keep the spine in the proper position. Without the uh, proper action of these muscles, we cannot hold the bones in position. We generally don't do proper exercise or yoga, and we simply rest our back on the chair, backrest of the chair, and want a good health is not at all actually possible. So maintaining the structure of the spine is first and foremost important as far as anatomy and physiology is concerned. And starting from uh, neck to hip, the spinal curvatures, there are four curvatures actually, and two primary and two secondary curvatures, and the curvature has to be maintained. So this is one part. And secondly, I will take the intestinal digestive system, gastrointestinal tract, and there are so many structures inside, and Pavanamuktasana is one of the asana generally helps to improve digestion and assimilation. Starting from mouth, the esophagus, we have got lower organs like stomach, duodenum, jejunum, ileum, and the large intestine, rectum, anal canal. So this Pavana Muktasana is generally called as wind release asana. Um, the term is something different. We might have heard this because generally in this position the gas is released. That's what the name is. Is named like that. So if you see the anatomy of this rectum and anal canal, you can see the uh, structure of rectum here, the anatomical position of the rectum. The lower end faces antero-inferiorly, whereas the anal canal faces postero-superiorly. Oh, sorry, postero-inferiorly. The lower end of the rectum faces antero-inferiorly, and the anal canal faces postero-inferiorly. And the ring, the muscular ring actually holds the rectum anteriorly. So, if you see the next picture, you can see the some of the structures in it, and through which uh, see the interior of the rectum, and the collection of um, motion actually the pieces is actually has to be pushed outside once it is collected. That is the major work of rectum and anal canal. So for so many people, this work doesn't happen properly, and this is one of the main reason for the diseases. If you see this structure, when you come to the uh, position like Pavana Mukta Asana, the anorectal junction, anorectal angle is actually increased. You see the uh, left one, the first picture, that is the actual anorectal angle in anatomical position. So when the position is changed, when the legs are folded, when the thigh is close to the belly, the anatomy is changed now. The anorectal angle is increased to almost around 160 170 degree angle, whereas in the normal anatomical position it is almost around 110 or so. So the puborectalis muscle is relaxed in uh, asanas like Pavana Muktasana. Even in the squatting position, Indian closet, if you use in the squatting position, the anorectal angle is increased in the same way, and so the defecation becomes very easy, and the reflex construction of the rectum becomes useful actually. So this position is very very important. So once you relax this puborectalis muscle and increase the anorectal junction, so the activity of the uh, lower gastrointestinal tract is supported with this position itself. So anatomy is that important. That's what we generally teach some Pavana Muktasana and asanas related to that. Even Sasangasana is almost like that. So such asanas actually support the intestines and lower abdominal, lower gastrointestinal tract, and you know encourage the normal defecation. So coming to the next issue, we will go into what is that respiratory system. Respiratory system is one of the important system actually, and we have got nose, trachea, uh, pharynx, etc., and even till alveoli. We have got it's a lengthy tube and holds so many air bags, air sacs, and uh, gives supplies oxygen to the blood. Very important system, and the health of respiratory system is very very essential. In this, we will discuss about two things. One is the respiratory muscles. So the respiratory muscles means there are intercostal muscles, there is a major muscle like diaphragm. In the next slide, I can see that the diaphragm is one of the important muscle of respiration. When it constrict, you breathe in, and when it relaxes, you breathe out. It's generally happens. So when the diaphragm constricts, there is a positive pressure, there is a negative pressure created in thorax, and air is sucked in. And when the diaphragm relaxes, then air is pushed out. So if you see the anatomy of diaphragm, so look at the next picture. So in that, the different structures and the nerves, arteries, veins passing through diaphragm is shown. Of course, diaphragm is supplied with the different nerves. That is not the matter now. There are three major openings in the diaphragm. So the diaphragm muscles are, attached to the previous slide. The diaphragm muscles are attached to the costal areas behind to the spine, and so on. But see that there is a aortic opening behind posteriorly, that is somewhere around at the level of 12th thoracic vertebrae. In that, aorta is passed, and also the what is that thoracic duct also passes through that, and you find esophageal hiatus at the middle, somewhere at the level of T10, 10th thoracic vertebra, and which is placed little bit to the left side, whereas the other important opening is caval hiatus, in which inferior vena cava, the major vein of the lower aspect of the body, passes through. So the importance of these structures is okay, but the anatomical change we see in the diaphragm while uh, breathing is very, very important. Say the aortic opening doesn't change during inhalation or exhalation, whereas the esophageal opening, it constricts. The esophageal sphincters are constricted during inhalation. So this is one of the important thing, and this is one of the best area for yoga people, where the esophagus is constricted, and this inhalation and retention. So Kumbhaka practice is very, very effective in case of acidity, regurgitation, and even in hiatus hernia. So when you hold the breath inside, the esophageal sphincters are constricted. So esophageal opening is fully constricted during deep inhalation. So when you inhale, as I said, the diaphragm sinks down, you know, comes down, whereas the esophageal opening is constricted. Whereas during the same inhalation, the caval hiatus, the opening through which inferior vena cava passes, remains dilated. It dilates more. So there is constriction in the esophageal opening, dilatation in the vena caval opening, so that the venous return to the heart is increased. So these are the two important things by we get by simple breathing, inhalation. So inhalation is very, very important practice, and that's what we always instruct the speed, rhythm, etc. of the breathing. So every breathing can change the anatomy and physiology of our body, and it improves the uh, quality of anatomy and physiology of our body. So whereas the aortic opening remains same, it doesn't change by inhalation or exhalation. So these two things we get, two results we get out of normal inhalation and kumbhaka. So that's about the anatomy of diaphragm. And if you move little upwards in the respiratory system, uh, the glottis and yeah, mainly the vocal cords, and that is one of the area we know about Ujjayi pranayama. Ujjayi pranayama. The next slide. Next. So the previous one, there is another slide in the yeah. So in the vocal cords, if you see this is the main structure, the glottis. Glottis is a small opening, and with two vocal folds at the sides. So Ujjayi Pranayama is practiced with the partial closure of the glottis. Generally, we practice Ujjayi Pranayama before going for meditation practices because it takes us to higher level. So when the glottis is closed partially, and it gives out a sound called as ocean sound. We call the sound as ocean sound because it is a mild sound we get. It is otherwise called as victorious breath. So the length and speed of the breath is controlled by partial closure of the glottis. So the mild vibration and the cooling stimulus during inhalation, take us to higher level. And the reason for this is the nerve supply of this particular area. So the vocal cords are supplied with the parasympathetic nerve, that is the vagus. Okay, the different branches of the vagus actually supplies to vocal cords. Superiorly, the area above the vocal folds is supplied from superior branch, and area below is supplied from the recurrent branch. Okay, so as the nerves are parasympathetic origin. When the breath, when we breathe, this particular nerve is stimulated so that it gives a feeling of relaxation. We know that the action of you know parasympathetic is the action of sympathetic is fight and flight, whereas the action of parasympathetic is rest and digest. So as the parasympathetic nerves are stimulated, we get a sort of we get the feeling of a relaxation. So practicing such pranayamas like Ujjayi is very important. The superior laryngeal nerve and uh, inferior or recurrent laryngeal nerves are the reason for this good effect. So, any pranayama, we know that after asanas we say pranayama, then dharana, dhyana, samadhi, etc. So, the pranayama, take us to the higher levels as it stimulates the relaxing, nerves mainly the parasympathetic in action. So, so that's about respiratory system. And moving to the next area is the kriya. Kriyas, if you say, I take, there are so many kriyas. I take Nauli. Nauli is not generally practiced by common people, but it is a wonderful kriya. So here the rectus abdominis muscles are moved right and left, so that this is called as churning Nauli. And this rectus abdominis muscles are strengthened. This is one of the important area, strengthening the muscular system. There are so many asanas, so many other practices, strengthens muscular system. But this rectus abdominis muscle is one of the important structure to be maintained, must be maintained. When there is no proper tone to the rectus abdominis muscle, there will be obesity and flabby muscles around the abdomen, etc. We know that. So the six packs and all we might have seen in cinemas and other gymnastic people. So the supportive asana may be Naukasana generally as asana, but the Nauli practice can give very good tone to the abdominal muscles and maintain the structure of the abdomen. It is it's very important to hold even the spine, because these muscles get connected with uh, lateral muscles and even posterior muscles. When the belly is pushed forward, then automatically the curvature of the spine is changed. That everybody know, it is again physics. So to maintain the structure of the rectus abdominis muscle is very essential, and we cannot imagine a healthy life without proper shape of the abdomen. So Nauli Kriya and this Naukasana are two supportive things to maintain the abdominal muscles. And coming down again, there are so many balancing asanas which controls mind, actually improves the physical mental coordination. There are so many balancing asanas. Actually we call the balancing asanas as advanced asanas, because to see they look very simple, but practicing with the closed eyes is very difficult. It may be Vrikshasana or even Tadasana, Garudasana, or like Sirsasana. This is a very advanced pose. So whatever asana, the balancing asanas improve the brain function and hormonal functions very much. It improves physical mental coordination, it improves memory, it improves concentration, etc. So these are the common practices generally may change your life, your everyday health very much. So what I recommend is do practice yoga every day. So you might have heard, an apple a day keeps doctor away. What I want to say is yoga every day keep doctor away. So practicing asanas or pranayamas or whatever form of yoga with the help of good qualified personality, will keep your health throughout, and you feel ease. You become strengthy like animals. You become light mentally, physically. Become very light like birds, and become strong like a plant. Okay, so to improve physical, mental, emotional well-being, it is very essential to practice yoga every day and maintain normal anatomy and physiology. That is very important. Our body structure must be normal, no encumbrance, no pushing forward or backward. So with this I complete my simple talk. So yoga is the journey of the self, through the self, to the self. This is a simple slogan. You can remember or write it and paste it at your bedroom and dining hall and even kitchen. Yoga is the journey of the self, through the self, to the self. So it is the practice to improve the health of mine and yours. So thank you, and we shall go to the question session now.
Thank you, sir. Thank you so much. It is an amazing session, and you have enlightened us, all of us. So, sir, the first question is which age would be appropriate for starting yoga asanas or yoga?
Actually, there is no fixed age but once you you are matured enough, that's what, because Patanjali Yoga Sutra says Stiram Sugam Asanam. So when you are capable of sitting freely in a particular position without mental fluctuation, that is very important. We think that children sit in a position for longer time. Of course, that is due to flexibility. We are not talking about the physical flexibility alone. Mental flexibility is very important. Mental control is very important. So when we are capable of sitting without thinking the other areas, children have got fluctuation of mind. So that is the area. Maybe that is the age. Maybe 7 years or so would be ideal age to start yoga practices.
Okay, sir. Uh, so, second question: what should be the basic principles of alignment one should follow to avoid injuries in yoga?
So actually, while doing yoga, you should never get injury. If you get injury, what you have done is not yoga. That is that we have to understand clearly. So any yoga practice, you must when you are beginner, you must start gradually. Simple practice. Go for simple practices first, then move on. If you practice yoga since childhood, it is okay. Then you can do anything. But if you start yoga after 50s or 60s, don't try to do Sirsasana all of a sudden. So that control you need, and always start the yoga with the guidance of proper guru. That is, then you won't get any injury.
Great, sir. And the third question: to get the desired benefit of yoga, whether it be on physical or mental, what should be the duration of practice?
So actually, practicing yoga every day is very important, and preferably the morning time is ideal, and to do it for half an hour to 1 hour, and I prefer 1 hour yoga every day. And if you practice regularly, even if you practice only asanas, you get mental benefits. And even if you practice only pranayama, you get mental benefits. But when you do the practice properly, like asana, pranayama, and a sort of meditation, it's a common practice. Generally, we go for, and that is a good one. And it may take approximately 1 hour, and that is very very good if you practice 1 hour yoga every day, and finish the yoga with proper relaxation, and that is very very important. Generally, some people do asanas and run off, and that cannot be accepted, and that is not allowed as per the yoga texts are concerned. So always finish the session with proper relaxation. That's very important.
Thank you, sir. Thank you so much for your valuable time. I feel you have enlightened all of us. Uh, yeah, thank you, sir.
Thank you very much.